Hi everyone, this is Anant. I wanted to make a video today trying out a new format about the launch announced earlier this week of Google's Care Studio product. And so if you haven't seen it already, I'll provide a link to the video and website description that they provided. But this is essentially a EHR navigation product that Google has built. It's something that a lot of people are paying attention to, A, because it's Google, and B, because everyone is interested in the potential impact they can have in the healthcare system through some of their initiatives, and this is kind of a first view into that. So I want to take a look at what this product is, how I think it works. Granted, I don't work there, but I do think I can offer some informed speculation based on my experience building an EHR at Verta and also just generally observing the space. So what's in it? How does it probably work? What is interesting and valuable from what they've done, and where do I see all this heading? So a little bit of context before we get into that. So this was developed for one specific health system called Ascension. It is a large health system that is dispersed across multiple states, and it is based in St. Louis, Missouri. And it is a health system that Google partnered with to essentially develop software and services to improve patient care. And so basically Google is given access to these health records and was able to build software and will continue to build software to deliver value to the Ascension health system. And so their first product as part of this partnership was Care Studio, and it was announced just earlier this week. So if you take a look at the video, what you see is essentially a EHR navigation product. It's view only. There's no capability to enter orders or write notes or anything like that. This is really about presenting the data in a way that's easier to consume. This has also been built for the inpatient setting and primarily for hospitalists who take care of patients in that setting. So just kind of reviewing what is in the video, you can see that there is patient search, the ability to search for patients. This apparently actually spans multiple EHRs, because my understanding is that Ascension actually has multiple EHRs across their health system. And so when the search is done, it's actually searching patients in multiple systems, which is nice. And then beyond that, you see some different graphical and tabular representations of different types of data, whether it's blood pressure, labs, other types of vital signs, that sort of thing. They do spend some time highlighting the capabilities around search. Surprise, surprise, Google's really good at search, in case you hadn't heard. And they were showcasing some of those capabilities as it related to the EHR. And so there were some points about using search to resemble natural language to find certain types of data. I saw someone punch in HbA1c. I saw someone type in CAD for coronary artery disease, and there was some results turned up to help guide therapy for whatever that inquiry was for. And then the last bit was showcasing the ability to view notes in a way that is contextually relevant. In this case, they were highlighting, for a given note, what is new, what is not new. This is kind of a consequence of the rampant copy pasting of notes that exists in medicine, which we can have a separate video about why that is the case. So notionally easier way to consume documentation in the note form. So how does this all work? Well, I speculate, again, I don't work at Google, but I speculate that what they've essentially done is they've taken the data from the various EHRs that Ascension has and basically consumed and transformed it into a somewhat harmonized format. So for those of you who don't know much about EHR data, EHRs can store data in a variety of different formats, and the fact that there is no widely accepted standard, or there hasn't been one, is a major problem to why the data is so hard to share. So there are multiple different types of data formats that are used, and if there were multiple EHRs involved in this project, then a major challenge, and I would actually say the bulk of the effort probably revolved around taking all of that data, finding some way to transform it and shape it into a common format so that it can then be consumed and presented in a user interface. I think it's that cleaning of the data that probably took up most of the effort. And once you have transformed the data into a clean format, actually the presentation and so forth becomes a little bit easier. And so essentially what's there beyond that is just an interface to present that data. There might also be some search algorithms and leveraging of natural language processing and machine learning to present things like search in a way that's more clinically relevant. But my guess is that most of the effort for this project was really in wrangling the data, transforming it, cleaning it up so that it could be consumed by a application like what the user interface was. So what's new and valuable in all of this? So to be honest, and again, I'm saying this without actually using the product. I only looked at a very brief teaser video that they put out. So the perspective is limited. But honestly, most of what I saw there is pretty much similar to what's contained in the gold standard EHR, which is Epic. I didn't see anything there that was dramatically different. I think, kind of putting my product manager hat on, I think that was intentional on their part. I think their goal in the initial release was just to kind of get something out there that was at parity to the regular EHR so that people didn't feel like there was any degradation of the experience relative to the regular EHR. So I think the goal was really to get parity. I mean, a lot of the views and interfaces actually look very, very similar to what's in Epic. And so that, I imagine, was their focus. There were some nice touches. I think the interface is generally cleaner. Using the material design pattern that Google has looks good. And then I think where you see some glimpses of where this could all be headed and where this becomes interesting is with the search and with the ability to use semantics and natural language to drive inquiry into the medical record. So I think those were like the interesting pieces, but what was shown was pretty limited there. And then, there was also that notes change highlighting, which is a nice touch, but that is actually something that is a borrowed concept from software engineering, where there's a concept of what's called a diff, where an engineer can view source code and compare it to old source code, and the presentation basically just highlights what has changed in the code. And I think what they showed there is just essentially doing the same thing for notes so that you can see, what is not just copy pasted from the last note. So overall, I think it's an interesting product, but I think what I see is pretty similar to what's in most EHRs, especially Epic, with some hints of some interesting stuff to come. So where do I see this all headed? So I think this is very early innings for this product. Again, I think the goal was just to get something out there that's usable, that they can start to iterate on and improve on. And I think my guess is that they succeeded with that. I think this looks to be more than viable in a clinical environment. I think some of the things that we won't know about are, what are the different steps that a clinician has to take to even access this? Are they having to open up a separate window to look at this? Because they still will need to enter orders and write notes, and we don't know how that all feels, but notionally I would say that this seems like a good initial step. And I think what we would be looking for over the coming months and years is for Google to iterate on this interface and to deliver more and more sophistication around search and presentation of data. I think that's where I would be really looking, is like, how can they actually deliver more value with respect to the search and inquiry into the chart using their unique capabilities with machine learning and natural language processing. What I would like to see a little bit more of is not just stuff that cleans up the presentation of data and makes the review of data quicker, but actually things that actually drive workflow. So I would like to see how this can all ultimately drive more efficient documentation, more efficient order entry, safer order entry, better order entry. I think there's lots of opportunity there, but right now, we seem to be kind of focused more so on just presentation of data, which again is logical. It's very hard to to move into the actual execution of tasks, but I would like to see that over the coming months and years with this. I think a lot of people are wondering, is Google going to build an EHR to compete with Epic and Cerner and Allscripts, and are these companies screwed? I think the answer is probably not. I don't think Google wants to get into the business of building EHRs. One reason for that is that EHR systems are highly, highly interconnected ecosystems that span not just the EHR, but which is used by doctors, but systems used by nursing, systems used by pharmacy, systems used by care coordination. And it just takes so much work to build out an ecosystem of applications that all works together. A lot of that requires really solid internal knowledge of kind of the bowels of the healthcare ecosystem. I don't think that's Google's core expertise. I think what their goal is here is to create a platform that can house the different types of clinical data. And I think that is going to be their Google Cloud platform, which they sell broadly across the enterprise space, but I think they're really targeting healthcare. And so my guess is that this is meant to be a tool that can sit on top of data that can be exported from an EHR into Google Cloud. And so I think the pitch will be, hey, health system, you can use whatever EHR you want. You can use whatever nursing system, pharmacy system you want, whatever you've just spent, hundreds of millions of dollars on. Just export all of that data into Google Cloud, and then we can do interesting things with that data, such as Care Studio and other things to come. So I think that this is a data play. I think this is a Google Cloud play at the end of the day. And I think that makes sense. Google is keenly aware of what it is uniquely good at, and this is one of those things. So overall, I think this is a very interesting first step for Google. I will certainly be keeping my eyes on what they're doing, as are a lot of people, and look forward to hearing more about this. Thanks for listening.